On the Auckland outbreak today, we are reporting 15 new community cases of COVID-19, and they are all in the Auckland area. That takes our total number of cases in this outbreak to 970, of whom 397 people have now recovered, which is good news. The fall in the number of cases today is encouraging, and even more encouraging is that there are no unlinked cases today. All of these new cases are household contacts from 5 known households, with the majority linked to just 3 households. We do know, of course, that Delta spreads more easily within households, so to some extent, these new cases were expected. While some of these houses have not yet been epi-linked to the wider outbreak, they have not popped up unexpectedly. Furthermore, you will recall that just one case from yesterday was, as at the point in time we announced yesterday, not linked to the outbreak. That case has now been linked. The number of cases in the last 14 days that are not yet epidemiologically linked has now fallen to 10. There are 22 people currently in Auckland hospitals, and of those, 4 are in intensive care and all require ventilation. Our priority is now on testing as many people as possible over coming days from the following suburbs in Tamaki Makaurau: Massey, Mangere, Whawona, Papatoetoe, Otara and Manurewa. If you live in these suburbs and you have symptoms, please do and go get a test. If you receive an invitation to be tested, even if you have no symptoms, I would encourage you strongly to take up that invitation too. It is part of our surveillance that we are doing in these suburbs. Of course, anyone across Auckland and indeed New Zealand with cold or flu symptoms, no matter how mild, please come forward for testing. We also encourage families with children to get tested altogether, as we are seeing COVID-19 cases in children, including quite a number in this outbreak. So if you're going out for a COVID-19 test, bring your whānau with you.
Aucklanders will hit 80% coverage of first vaccinations in 1 week's time, and we'll be well on our way to the city being better protected against the virus. Let me be clear on why is it important. It literally saves lives and prevents hospitalisations. There's real-world evidence here in New Zealand and internationally that proves you're far less likely to get COVID and far less likely to get sick and need to go to hospital if you are vaccinated. Getting vaccinated protects you, your family, your loved ones, and our economy. That's why it's so important to everyone, but especially those in Tamaki Makaurau, to get vaccinated as soon as possible. In fact, if you're sitting at home in Auckland watching this now or listening on the radio and you are yet to get your first vaccine, I'm going to suggest that as soon as I've wrapped up, you go and make a booking. That includes people who may have bookings later in the month or in October. Chances are you'll be able to bring that booking forward to this week. You can do this online at Book My Vaccine. Just remember, though, to cancel your original booking. There are around 90,000 available spaces in Book My Vaccine in Auckland for this week, so bringing forward a booking shouldn't be a problem. And you can also try your GP. More GP clinics and pharmacies are coming online every day. There are now more than 100 GPs and 30 pharmacies delivering vaccinations across Auckland, so give them a call and see if they have any spaces available this week. Meanwhile, our 2 drive-through sites at the Auckland Airport Park and Ride and Truss Arena in Henderson can do over 5,000 per day across each site. No booking is required. You can simply show up. As well as these standard options, there are some other great examples of initiatives that are making the vaccine accessible to everyone. I thought I would touch on a few of them briefly. A pop-up clinic at the University of Auckland for on-site residents, students and staff began on Saturday and has its final day today. It's in the Owen Glen building on Grafton Road. The Northern Region Health Coordination Centre has been running vaccination centres at 4 specialist schools in Auckland: Somerville, Parkside, Wairoa Valley and Wilson, with hundreds of students and their families vaccinated at those sites over the last 2 weeks. International evidence tells us that COVID has caused disproportionate harm for disabled people, so we're working hard to get the vaccine to this group of New Zealanders. This morning, Minister for Disability Issues, Carmel Sepuloni, helped launch a Taikura Trust initiative at Papakura Marae to get disabled people vaccinated. They will be prioritising vaccinations for the disabled all week at the marae. The clinic is open from 9 till 3, Monday to Friday, at 29 Hanua Road, Papakura. You don't have to book, but try to be there by 2 p.m. at least, at the latest, so you can be processed. This follows similar initiatives elsewhere in the country. For example, the Hutt Valley DHB and Autism New Zealand provided an autism-friendly vaccination option in Petone. I've heard really encouraging stories of those with autism who have never before participated in a vaccination program accessing a vaccine against COVID. Now, there's been much talk of a Mr. Whippy-style mobile vaccine bus or portable vaccinations. I'm pleased to confirm that the Northern Region Health Coordination Centre will launch its first buses this Thursday. The initial plan is to take them into areas where we know vaccination numbers have been low or people have not been able to access vaccination services as easily. The aim is to increase the network from an expected 6 on Thursday to 12 over the coming weeks. A huge thanks to Auckland Airport and Bus Travel New Zealand, who have supplied buses for this work. I know in Australia they've started operating something similar and have named their mobile outreach clinics Jabba the Bus. I'm sure that we can do better. The vaccine is the best tool we have in our toolbox and our ticket to greater freedoms. The more people who are vaccinated, the fewer restrictions that you have to have. Just as we've been world leading with the success of our elimination strategy, in the future I want New Zealand to be world leading both on the level of freedoms and our health and well-being. And high rates of vaccination is how we can achieve just that.